What is the connection between poverty and drug abuse initiatives? Have you ever wondered how poverty and drug abuse are connected? This relationship is complex and can create cycles that are tough to break. Understanding this connection is essential for effective community anti-drug initiatives. At its core, poverty means lacking enough money for basic needs like food, housing, and health care. People living in poverty often experience high stress levels, limited education, and fewer job opportunities. These tough conditions can lead some to use drugs as a way to cope with emotional pain or escape their reality. Research indicates that individuals earning less than $20,000 a year are significantly more likely to struggle with heroin addiction compared to those with higher incomes. Unemployment plays a big role too. Individuals without jobs are about twice as likely to face substance use problems as those who are employed. The impact of childhood poverty is also significant. Growing up poor, especially during teenage years, increases the risk of developing drug use disorders later in life. Instability during these formative years, like moving in and out of poverty or experiencing sudden drops in family income, can be particularly harmful. These experiences can affect mental health and raise the likelihood of turning to substances. However, it is important to note that the connection is not just one way. Drug abuse can also lead to poverty. Addiction can make it difficult to keep a job, pay bills, or maintain relationships. As substance use worsens, individuals may lose their jobs, struggle to find new ones, and face even greater financial hardship. This creates a downward spiral where drug use and poverty reinforce each other. Community anti-drug initiatives must consider these connections. Programs that focus solely on stopping drug use without addressing poverty, unemployment, or mental health are less likely to succeed. Effective initiatives often combine drug prevention and treatment with efforts to reduce poverty. This can include job training, education programs, and access to mental health services. For example, in areas with high poverty rates, such as Appalachia, opioid addiction became widespread partly due to job-related injuries and limited economic opportunities. Initiatives in these regions now often include both addiction treatment and support for finding stable, well-paying work. It is also essential to remember that not everyone living in poverty will develop a substance use problem, and not everyone with an addiction comes from poverty. Factors like genetics, family history, and personal experiences all play a role. But poverty creates conditions that make drug abuse more likely and recovery more challenging. The connection between poverty and drug abuse is a two-way street. Poverty increases the risk of substance use, and substance use can deepen poverty. Community anti-drug initiatives are most effective when they address both issues together, offering support for addiction recovery alongside opportunities to improve economic stability and mental health. This approach helps break the cycle and gives individuals a better chance at long-term recovery.